All right, welcome everybody. We are so excited that you guys are on here tonight. My name is Blair Critch, and we have an amazing lineup for you. Oh my goodness. Actually, you know who I don't see on here is Honey. Let me just text her our link really quick. Sorry, I just realized that. All right, perfect. Let's see. You don't see her on either, do you, Kelly? I'm not missing her, am I?
No, I can text her though. I'll text her too.
Okay, awesome. Thanks, guys. All right. Well, welcome everybody. My name is Blair Critch. I'm so excited that you guys are popping on here tonight. We have a special lineup for you guys. And if you hopped on here tonight because somebody invited you, shout them out in the chat. If you're not familiar with where the chat is and you're new to Zoom, if you are on the computer, you can go down to the bottom. There's like this little bubble. It looks like the comic strip, like this is my age. I used to read the Sunday comics. Hi, honey. And so you can click the chat at the bottom and share with us who invited you tonight. And if you are on here tonight and you're currently taking a peptide, we'd love to know what peptide you're taking. And we are so excited that you guys are on here tonight. So, welcome. We have an amazing lineup for you guys. We have all different kinds of stories that are going to be shared, but we're going to start off first with the vision and the reason that we're all here. So, we are so thankful for a company like LEMD that's making longevity products, sexual health products, weight management products, and soon to come hormone replacement products accessible to everybody from the comfort of your own home through a telehealth concierge company that Honey Sagari created. And we are all so thankful to be a part of. And so I asked Honey if she would hop on here tonight and share with you guys a little bit about why she created this company, her vision, her story. And then you guys are going to hear from three people who have three completely different stories tonight about how peptides have changed their life and impacted their health. So Honey, I'm going to let you go ahead and start by sharing a little bit. And we're so thankful that you're on tonight. Thank you so much.
Oh, you're so welcome. Hi, everyone. Happy Wednesday. Hope you're all doing really, really well. What a day we had with such incredible announcements, our new partnerships with pharmacies, and my God, the expansion of our microdosing offering to all 50 states. That is huge. I mean, I don't know any other company out there right now that's making microdosing accessible to the masses the way that we are. And I think just talking about the vision of where we're going, what we're doing. We're really trying to make our impact in the world of not just longevity, but healthcare. I come from the sick care world where, I've dealt with a lot of end of life patient. And if you guys don't know, most of your healthcare spendings are spent in those last 10 years of life. So if we can live into our aging in a healthy way, we get those quality of years with our loved ones. What a gift it is, not just for ourselves, but for society and to our loved ones. So that's what we're here to do. We're here to, with Team Joy, spread the joy of longevity, wellness, making functional medicine accessible, shifting the paradigm of healthcare from what it is right now. It's sick care. We are a sick country. I mean, 70% overweight rate. That's not right. So shifting that paradigm from sick care to healthcare and wellness and quality of life. I think it's such a gift. And it starts with us, with our communities. It starts with ourself, being an advocate for ourself first and foremost, and then rising and lifting everybody else up, just like our little elephant over here. That's a clover it's holding up. It's a community. Someone's like, is that a lollipop? Is that a balloon? No, that's Horton. That's Ellie following in the footsteps of Horton Here's a Who. And Horton became the voice of the Who's in Whoville. And here we are becoming the voices and the advocates for our community. So that's really what we're here to do. That's the vision. And I think weight is such a easy, low hanging fruit. I've lost close to 100 pounds myself. I come from the world of healthcare, and here I was teaching patients on how to live better. And I'm sick myself. Like, how does that make sense? So, I've been desperate at one point or another in my life. I don't know if I've shared this story with you guys. I was so desperate, 235 pounds. I didn't even own a scale. I weighed myself on a pallet jack scale in my warehouse. And I'm like, how did I get here? How did the weight just come on overnight? So I got a real scale after that. And I was like, wow, we got to do something. And I was so desperate. I got on an airplane. I went to Mexico. I got gastric lap band surgery. That's That's how desperate I was. And sure enough, within 9 months, my stomach flipped on itself. The port site was being rejected. So and failure is sometimes a beautiful tool that you could use as a stepping stone. So I learned everything there was about nutrition and health, and I lost a significant amount of weight, close to 70, 75 pounds in a short period of time. Then baby number one came, then baby number two came shortly after, and I was right back up to that same place that I started, a little bit less, 225 pounds. I did all the things that I had done previously. I got my weight down to 190, 185, 190, and it just wouldn't budge. So I found GLP-1s at a conference, the compounded version, and the weight started coming off. And I was like, oh my God, I gotta spread the word. And here we are today. It's been a game changer for me, for so many people. And that's that big lever. So we're going to pull that. And from here, we can fine tune all the other levers when it comes to longevity. We have access to great peptides, especially now with our new pharmacy partnership. They have access to so many peptides that other pharmacies don't have. So we'll make that available to you guys over time. And I'm just really excited for where we are, where we're going. Hormone therapy is going to be huge. Our diagnostics are going to be really big. Our building out the GLP-1 nutritional support program that's coming in the next few weeks. That is going to be huge. So I'm really excited. I mean, we're really making an impact, and we've already made a huge impact in this community, this beautiful community that we have. And it's going to grow and grow and grow from there. It's been thousands of customers so far that are happy, and they're like just in awe of how their body's changing. And, we're reversing sickness. We're slowing down and even reversing the aging process. Like, give yourself a round of applause if you're part of this community and you're having that sort of impact in your patients' lives. So thank you all so much for being here. And I'm excited for this journey that we're all on.
I love that. Before we move on to our stories, will you share a little bit of snippet? Because this is one of my favorite things about the company and about why you started it, which is your story about when your parents first moved you here from another country and your new friends that you found and how that kind of started your journey in the longevity and preventative health.
Oh yeah, well that's I think that's the seed of passion and the why. Maybe the how has changed over time, but my why has been very it's been the same ever since I was a little girl. So our family, we're immigrants. We moved to the US, and my dad, he had been here with the Iranian Revolution. Everything is pre-revolution, post-revolution. So my dad came here pre-revolution and stayed here, married my mom, and it took a really long time to legally bring us to the US while he was still here. So when we moved here, my dad moved us to this little town of Verona, New Jersey, and it was the 65 plus community. It was more like 85 plus. And these grannies just took me under their wing. I was the newcomer in the community, and they loved on me and they gave me so much love. And, I was eating dinner at Miss Madeline's, doing jewelry with Miss Diz and this. And every day I was at one of my friends' homes. But, little by little, I started to lose my friends, and I was attending more funerals than birthday parties. So I remember, like, as a little girl, I told my mom, I was like, I'm going to figure out how to keep my friends around for as long as possible. So that was the what. And my why was I want to keep my friends around for as long as possible. So as soon as I could get a legal job, I worked at a nursing home. I think I was 14 or 15. And same thing, I'm going to keep my friends around for as long as possible, was gather them and spread the joy. This is Team Joy. So you guys know all about that. And I just, I would, after the bosses would go home, I would gather them in the corridor and we would sing and we would dance and they would just come to life. These were patients in wheelchairs and they were so happy. And from there, when I went on to college, I would still catch my buses to come to that nursing home because I was like, I'm there to keep my friends around for as long as possible. And after graduating college, I started a program in biochemistry and gerontology shortly after. And I was like, I got to learn the body, all the gears, how the gears of the body work. So I learned the body on a cellular level. the mind body connection. I had it. And we launched a program at the U of M Health System. It was a program started at Yale University. We brought it to U of M, and it was a set of protocols to help maintain baseline in hospitalized patients that experienced delirium. So I was like, oh my God, I had this brilliant idea. And there were certain other protocols that researchers had put together of maintaining baseline in Alzheimer's and dementia patients. So I started a home healthcare company shortly after that focused on maintaining baseline in Alzheimer's and dementia patients. And I was so, I don't know, excited to run these protocols. I was also teaching about Alzheimer's and dementia and maintaining baseline in nursing homes and so forth. And quickly I realized I'm doing this whole thing wrong. First of all, my impact is so localized. And number two, I'm teaching bedridden end-of-life patients about healthy living and maintain, like, what if we started at the beginning instead of allowing the disease progression to take place? What if we prevented it in the first place? So that's how I started my first company. It was an approach of how do we incorporate preventative medicine, telehealth, with personalization of prescription grade products. And the rest is history. Here we are today with LEMD. We're doing just that. And incorporating our beautiful community of advocates, you guys, to make that vision come to fruition.
Well, thank you. We're so thankful for your vision and the accessibility to people. So we have 3 stories that you guys are going to hear tonight, but I want to just tell you guys a little bit too about how I got involved in peptides. Was I've actually been on some for about 1.5 years. And when I was approached with learning about what Honey had started here at LEMD at the beginning of August by Beth on here, I was blown away because there were so many times this last 1.5 years that I've been on NAD, which completely helped my menopause symptoms and helped to get rid of a lot of pain and discomfort in my body and reduce inflammation in my body. Then I got on a GLP-1 and I lost 33 pounds during menopause, which is huge. If any of you are in menopause, you know how hard it is during that time. And I was eating plant-based and working out every day and doing all the right things and could not lose this weight. And then fast forward to lost that weight within about 7 months and have been microdosing ever since. So when I was introduced to LEMD in August, I knew I had to partner with this company because I have so many people asking me questions over the last 1.5 years. What are you doing? Why does your skin look so good? Why is your hair looking so amazing? How have you lost that weight? What are you doing to stay healthy? A lot of people also know that I had a cancer journey in 2020, 2021. I went through ovarian cancer, 6 rounds of chemo, lost my hair, the whole thing. So people have seen a difference in me and they wanted to know how, but I had a local person here in Florida that was very expensive and not accessible to everybody. So now that I can share these products with everybody all over the United States, it brings me so much joy. I get messages all the time. Some of you might even be on here tonight that are like, thank you so much for sharing this with me. I can't believe how great I feel. And one of those people is Ashley Casey. So I'm so thankful that she's going to be sharing tonight. And here's the thing. We've got 3 different amazing women sharing tonight, and they're all 3 in different ages. So Ashley literally just turned 40, like last week, and she started on NAD not too long ago and already is having incredible results. So Ashley, I'm going to let you share with everybody your results so far on NAD.
Yes, and thank you, Blair, because if it wasn't for you, I wouldn't be here and I wouldn't feel as amazing as I am. So because of Blair, she reached out to me one day and she was, pretty much asking me like, what is it that I'm struggling with? And I was telling her like my symptoms and she's like, oh, well, you need to try NAD. So before I get into my story, I'll tell you a little backstory real quick and I'll try to make this 2 minutes long. So a couple years prior, I was actually on Adderall. And it actually was this year, a couple months ago, I finally talked about it. It was something that I was very afraid to talk about. But I was on Adderall for a couple of years because I needed it for focus. I was doing Zooms back to back all day long, coaching women. And that's why I was on Adderall. However, wasn't realizing until I realized that it was literally killing me from the inside out. I got down to 100 pounds. I was so tiny. My face was sunken in. So glad that that is done and over with. But in that time frame for the couple of years, it was trying to get me back, but also trying to have the energy and looking for that mental clarity and the focus. Like I just had this cloud over my head all the time, and I just could not get rid of it. So when Blair was talking to me about NAD, I just immediately talked to my husband, Chris, and he's like, let's do it. I think this will be good for you, honey. And so ordered the NAD, and it was my third weekend that I did my injection. Because it does take a little bit of time. Everybody's a little different, but on that third week, I remember like it was yesterday. I looked at Chris and I was like, babe. And he's like, what? And I'm like, it hit. And he's like, what are you talking about? I'm like, the NAD, like I feel it. I feel so good. And I was just literally, you guys, I was like a little bunny. I was so excited. Like the mental clarity was there, the focus was there, the energy was there. And yes, I did just turn 40, but I'm also premenopausal. And I was having, and I also hated talking about this because it was embarrassing, but I'm over it now. But I had hot flashes at night, and it only happened at night, which was also causing me not to sleep well. It was so every morning I would wake up and I was so tired. But needless to say, I'm no longer having hot flashes and I'm sleeping like a baby, which is also in turn helping me with the energy, right? So NAD just 100% has changed the game for me. I highly recommend it. So that's my story.
Thank you so much, Ashley. Yeah, and you guys, listen, it can help anybody, no matter, if you're going through menopause or not. But I had a very similar journey with the menopause experience. And yes, after my second injection, I went from having 15 hot flashes a day. And I'm talking like the kind of sweat where you're embarrassed to get up from your chair because you might have left a sweat mark on the chair, kind of hot, to literally maybe one a day. And now, after being on the product for much longer, I very rarely ever get a hot flash. It's really incredible. But it took away so many other symptoms that I was having as well. And reducing inflammation, we all know inflammation is like the root of all evil, I say, because it is literally inflammation is what breeds disease and all kinds of horrible things in our body. So next, I'm so excited to share with you guys to have Summer Blazer is going to be sharing with us. So Summer is in her 50s and she was a dancer, or still is a dancer, by the way, because I saw a video up on her, like a reel or something up on her stories, and I was like, dang, that girl can dance. So I'm so excited for Summer to share with you guys. She is microdosing. We just launched microdosing of our GLP-1s. So we have two options right now. We have semaglutide and tirzepatide for microdosing. And I will give you guys this little tip. And maybe Kelly can type it in the notes for us in the chat feature. If you have not checked out Dr. Tina, she is phenomenal. It's a podcast I've been listening to for a very long time, but she has a 4-part series about microdosing GLP-1 that's incredible. You can go on her website, sign up for the email. She'll send you one a day for 4 days straight. But the benefits of microdosing are incredible. So Summer, will you unmute yourself and share with us your experience?
Hi guys. Hey, thanks for having me. I'm super excited to
Okay, hold
share
on.
just
Everybody,
because
look how gorgeous she is. How old are you?
oh, thank you. I'm 52.
I mean, dang.
Yay. And I feel like we're getting better. We're getting better. So my story really is most of my life I had the wellness thing down. I was a professional dancer. I worked out, I ate well, I did okay. My older friends would kind of give me that look and say, girl, just you wait, menopause around the corner, you're going to struggle. And I would just laugh it off, to be honest, and think, they were just being dramatic. But, menopause showed up for me. The struggle went from 0 to 60. And let me tell you, those ladies were not exaggerating. I mean, I gained weight, had the hot flashes. My body felt like I was constantly inflamed. I was tired. I was having trouble sleeping. It became really strange to look in the mirror or see a photo of myself, that I didn't recognize. And I mean, also because I love fashion, and suddenly nothing was fitting right. Things just weren't draping like they used to. Things were clinging in areas that I didn't realize I had. I researched and tried several supplements, and really none of them made a dent for me. It was really disappointing. I was struggling. Finally, I tried GLP-1. I didn't tell anyone. I tried it on the down low. I told my hubby, but that was it. I wasn't thrilled about like needing a shot, something to help me, but I started microdosing anyway. And I was pleasantly surprised that the needle is like a strand of hair. Super easy, and I either put it in my stomach or I put it in my bass, your low back where it touches after a short period of time, the inflammation started to go down. I started feeling better. The energy came back. I started dancing again. And the food noise that I didn't realize I had, it allowed that to quiet, which allowed me to make more mindful, like nourishing decisions around food. rather than always thinking about what's my next meal going to be. So over 5 to 6 months, I lost 32 pounds and yay. And so I'm 10 months in now. I continue to microdose and I'm really doing it for the regenerative longevity effects at this point. And I feel like a lot of women really keep stuff on the down low, especially when we're going through like midlife, and we just need to share. And that's really why I ultimately came out with my story, because like I said, I was really quiet and secretive about it because I somewhat felt ashamed to need assistance. And now I'm like, oh my gosh, everybody needs to know. So yeah, now my hubby's on it. I can't wait to get my parents started. I'm like, let's all just live this life as long as possible, as healthy as possible.
Oh, I love that. As healthy as possible. So true, Summer. Thank you so much for sharing. And it's so true. How often do we keep these things a secret? But we could really be helping and impacting so many people by sharing it. So thank you so much for sharing tonight and being open to sharing. So our next story is Liz Wilkerson. And Liz is in her 60s and decided to try one of our products called Synapsin. And I'm really excited for you guys to hear from her. And actually, before she comes on, honey, I love your explanation of Synapsin. Would you mind explaining really quick what Synapsin is?
Yeah, so Dr. Lavelle, I don't know if you guys are familiar with him, if you're into the world of peptide therapy. He's a legend in this industry. He's been talking about peptides for a very long time. And Dr. Lavelle came out with this formulation. He's a pharmacist, he's a PharmD. In addition to that, he's also a naturopath doctor. So this is his signature formula that took a while to bring into the compounding pharmacies. And it's a combination of RG3 and NAD. And RG3 comes from ginseng. It's a ginseng concentrate. So it has all these therapeutic benefits. It has benefits with neuroinflammation and focus and mood. And my gosh, the benefits go on and on. But that's it in a nutshell. It's really good. Someone was telling me, it's like, I've never tried cocaine, but it feels that way. It feels like a stimulant without being a stimulant. I'm just like, I just get this focus and this energy boost, and I feel amazing when I'm on it. So those are some of the feedback that I've gotten. I haven't tried it yet. I've done a lot of the research and read a lot about it for a very long time, even before LEMD started. I had the privilege of talking to Dr. Lavelle at one of our conferences, and he was talking about it. I was like, oh my God, I am sold. I can't wait to try it. And I haven't been able to get my hands on it because it's not available in California or New Jersey. So, but I'm gonna get myself some Synapsin ASAP. I want it, but
I have to tell you, that's one of the benefits of living in Florida. I'm not gonna lie. Everything here in the Wild Wild West.
that's one I haven't tried. I've tried everything else except this one. So
Well,
I
it
mean,
is pretty awesome. I wouldn't say it's like cocaine, but I will say it does help you with like immediately you feel that focus and you do feel some energy, which is really cool. And definitely some drive. So Liz, will you share with us what you've been experiencing since you've been on the product?
Absolutely. And it's so funny she said that because that is exactly part of my story. And I'll get to that in a second. But thank you, honey, for sharing that. That is really interesting. So, hi, everybody. I'm so glad to be here. Liz Wilkerson. I'm 67 years old, and I've always been active my whole life. Just been in sports, black belt in karate for 16 years. I've just been slim and healthy my whole life. But in the last 4 or so years, I noticed that I was really starting to just feel different. Just I felt it was just like I was getting older, and I just kind of contributed to that. But my husband and I live on a horse farm. We have 10 animals and 14 acres to take care of, so I'm always working and I just get tired easier. I actually started taking a nap at 3 o'clock in the afternoon every day because I just felt like I really needed it. And I didn't even have to look at the clock. I could just tell by the way I was just tired that it was 3 o'clock, time for my nap, right? Little old lady thing or whatever. But I just really noticed too that some of the things that I was experiencing, starting to experience more as I was aging, was I was becoming more forgetful. I would notice that I would meet someone, I'd be introduced to someone, and I actually would forget their name like 5 or 10 minutes or a half hour later. And that is so embarrassing. I don't know if any of you girls have ever done that, but it's horrible. It's just really very embarrassing. And I was experiencing other things too that were brain health type things that I didn't even realize that I was suffering from that. But Synapsin is a brain health product, and it comes in this really cute little bottle. It's just wonderful. You just shake it up and up. It's just wonderful. It's so easy to use. And when I wanted to use it because I was experiencing a lot of the symptoms that come with, I thought was aging. But I was so wrong because I was noticing that I was not as mentally sharp and focused as I used to be when I was younger. I would get brain fog all the time. And I also had been doing a lot of Zoom meetings since I got my insurance license since 2020, hundreds of Zoom meetings. So my brain was just like, ugh, and I just was feeling overwhelmed. I was experiencing a lack of energy, and I just accepted it, sadly, as part of aging. But I was wrong. When I tried Synapsin for the first time, I instantly was wide awake. And the first thing I noticed when I looked in the mirror was like my eyes were wide open. It's like, wow, this is like instant energy. And it was just incredible. I mean, I instantly became more energetic, happier. I wasn't suffering from depression. I was just like totally happy. I felt like smarter and rearing to take on my day. So I take my Synapsin first thing in the morning, every morning. I don't even drink coffee anymore. I don't even need my cup of coffee, which I've been drinking like since I was 19. That's a long time to be drinking coffee every day. Now I just take my Synapsin in the morning. It's the perfect way to start my day. I just love it. And it's so funny because it kind of reminds me of just shooting a couple little drops of my nose of Fountain of Youth or something. It's just that incredible. It's like two little snips up my nose and I feel like I'm younger. I hope you guys really get a chance to use it. I totally love this product. I highly recommend it, and I just can't say enough good things about it. So it's great. You got to try it.
Thank you so much, Liz. And I actually just started on it as well. I'm only on week 2, but I was noticing that post chemo, I was getting this weird, like I call it chemo brain. It was like I was switching letters and numbers sometimes in my head.
Yeah.
And I also was having the same issue that you said, Liz, which is like forgetting somebody who like maybe I just met an hour ago. I forgot their name. And it was very frustrating. And I felt like I could focus on things, but I couldn't remember those quick, short-term memory things. So I love that you shared that. Thank you so much, Liz.
You're welcome.
And yeah, I've only been on it for 2 weeks now, you guys, and I can already tell a big difference. And my husband's on it as well. And I asked him tonight when we go in the hot tub every night together. I was like, hey, have you noticed anything? I'm getting on the Zoom tonight. And he's like, yeah, I definitely love it. Like I can definitely tell. And we both have been working really hard the last couple weeks. And he's like, I can definitely tell that focus. And so I'm loving that product as well. So, these are just some of our amazing products. So like Honey said at the beginning, we actually have longevity, sexual health, and weight management, and soon to come our blood diagnostic kits and hormone health. But under that longevity category, we have multiple peptides. And with our GLP-1s, we have microdosing as well as regular with tirzepatide and semaglutide. And we also have a sexual health product called PT141, which we'll have to do a whole nother Zoom on, but that one's amazing as well. And we'll have to be very picky about who I allow on here as I tell that story, because it's an amazing story. But we love our products, and there's so many great products. So if you were invited here tonight, you have an opportunity to be a customer with LEMD, and you also have the opportunity to become a brand partner. So by becoming a customer, how this process works with us is whoever invited you, you look through the website, you see what's right for what you feel like is right for you and what you're going through right now. There's tons of information on the website. If you went to NAD, for example, on our website, underneath it, you can see all the things that's so great about NAD and what it does. And then underneath that, there's frequently asked questions with more information. And underneath that, there's even scientific research and scientific journal information that you can read about. So go find what's right for you right now. And then you actually, once you put it in your cart, you meet with a telehealth doctor and they decide if you are accepted or denied. That's where the telehealth part comes in. And then if you're accepted, it goes to our compound pharmacy, which is an FDA approved pharmacy, and your product arrives to you at your door. And it's so easy and so simple. And yet what's so great is it's accessible to everyone. So I love that. So you can be a customer with us, but if you're like, hey, I'm going to get on these products, and if I love them, I want to share it with people. Like Summer said, we don't need to keep this a secret. If you feel great and we can help people with preventative health, we need to share that with more people, right? One of my favorite things right now, I know we keep bringing up menopause, but that's what I'm in right now. One of my favorite things is when I first started learning about menopause 3 years ago, there wasn't a lot of stuff out there. It has become very mainstream. There's a lot of celebrities. There's a lot of legislation that's going through right now. There's a lot of information out there now because people are talking talking about it. So if you want to talk about the things that are helping you and you want to share with others and help them to feel their best, there's a brand partner opportunity here. And when you join us as a brand partner, you have the option to earn money off of your sales. You can earn 20 to 40% commission. We call that our affiliate side. So you can jump in, share it with people, and based on how much you sell that month, you can earn anywhere from 20 to 40% back in commissions. And then we also have another part of our brand partner experience where you can actually build a team, which is what a lot of us in here are part of, Team Joy, and build a community of people that are also out there sharing products, and you can earn a commission off of that as well. And what's really great is the fact that there are all different ways to earn money in this business, but it really all comes down to helping other people. And one of my favorite quotes of all time is by Zig Ziglar, and he says, if there's something that you want, help a bunch of other people reach their goals, and then you'll reach your goal. I know I butchered that. Sorry, guys, but that is like my way of saying it. Basically, helping other people to be healthy and to be strong and to be, preventative health, then you'll get the success that you're wanting to achieve in life. So we're so thankful that you guys hopped on here tonight. Please get back with the person who invited you. Tell them thank you. They invited you because they care and they want you to hear about the information about these products. Like I said, there's tons of information on the site, so go check it out. And if you have any questions, get back with the person who invited you and go ahead and place that order. Give yourself the gift of preventative health this season. There is nothing better that you could do for yourself and for your family than take care of yourself and prevent yourself. I'll tell you this, after going through cancer, my husband and I were talking about it tonight. I think I probably spent $50,000 to $60,000 when I had cancer. Number one, because of extra expenses outside of my insurance. Second, all the other stuff that I had to do to keep myself feeling good while I was going through this horrible chemo poison, right? So if you want to take care of yourself, longevity is the way to go. So we are so thankful that you took the time tonight to be with us, and we hope you have a great night. Thank you, honey. Thank you, Liz. Thank you, Summer. Thank you, Ashley. We're so thankful you guys were willing to share tonight. Bye, everybody.